Good evening, everyone. I run a company called ekincare, which is primarily into health benefits platform. So the topic of today is primarily in terms of how we are helping the ecosystem with our technology, and especially on the healthcare front, right? So the healthcare is in India is pretty big when it comes to the numbers, right? Whether you look at it from a B2C point of view, we are a B2B company. And primarily, if you look at it, there's 90 million lives who are privately insured currently through group insurance policies when it comes to India point of view. And they're spending close to $12 billion when it comes to healthcare spent out of pocket currently in India, right? And the problem statement that we are trying to solve when it comes to the spend is India Inc. Is crucial for the economy, but the problem is most of the employees that are part of this corporate industry or corporate India is pretty sick, right? Sick in the sense you see 1 in 2 are suffering from chronic conditions. 42% is suffering from mental wellness, and a lot of them started to rethink employee health benefits when it as part of the COVID pandemic, right? I mean, and most of them felt that their existing benefits did not help. And the bigger problem statement that we have is it's not like companies weren't spending. A lot of companies were spending even prior to the pandemic on employee health and employee health benefits, right? But the problem was none of it was personalized. It was more like one size fits all, and none of it was data driven in terms of interventions, or more importantly, in terms of personalization of these interventions, right? And that's where we provide a full stack health benefits platform, which is more personalized and preventive. And the mission statement that we are after is to make corporate India healthy, right? And part of that is we have a patented technology which is primarily there to extract data from multiple interventions, whether it be your diagnostics, health checkups, care management program. Then we use all this data to personalize the journey of an individual based on their medical condition, and more importantly, we also connect them to various service providers uh, to to provide the continuity of care, and more importantly, access, right? Uh, this is now this is, for example, what happened during pandemic was we work with more than 200 companies who are our clients, who have more than 300,000 employees currently on the platform. But the fundamental problem was when pandemic hit, a lot of these employees started migrating towards their hometowns, right? Tier 3, Tier 4 cities. And the interesting part was that's when companies started to realize that they needed a digital end-to-end digital platform where they can provide same unified health benefits to their employees, irrespective of where they are and if they're working from home as well. And that's when that was a watershed moment for somebody like Ekincare, where we had an opportunity to provide a digital solutions to thousands and thousands of employees across 150 cities through our network of service providers, and we've seen a huge uptake when it comes to engagement, adoption, and more importantly, uh, teleconsultations grew by 400% in the last 6 to 9 months, and this is all because the the opportunity, or I would say the outcome of the pandemic, where employees started working remotely from their own hometowns, right? How we are addressing this problem statement of making India Inc. healthy as today. A lot of this is driven purely through jugaad, I would say, through Excel sheets. Through they just provide something for the sake of it, and there's no real outcome. There's no tracking in terms of how somebody is, if an individual is getting healthy or not. And that's where our patented technology comes into the picture, where we are able to extract the data and provide real-time analytics to a decision maker to assess uh, who are they spending, how are they spending, when, where, how, and why, right? And all this is part of the analytics that we build from the data that we are collecting across thousands of patients. And then using this information, we personalize the journey based on which we engage the user better in helping them in their healthcare journey, right? And more importantly, tracking if they are actually improving or not improving. So the net is it's not just providing access, but also gathering the information, personalizing the journey of an individual, an employee, and then using that information to drive better outcomes. We've done this across 200 companies, and there is a huge interest. I mean, one of the interesting outcome that we are seeing is today even companies are starting to spend around 8 to 10%. There is the most interesting trend that we are seeing is there are companies who are starting to allocate 8 to 10% of their basic pay per employee towards employee wellness, which was not so much, I would say, prior to the pandemic, right? So
Thank you.
there is an increased effort towards employee health.
Kiran, this is wonderful because the employee workforce, especially when you look at the public sector employee workforce, and it's got quite a nice trend nowadays. So if you see one of the manufacturing organizations says people can work from home, it's a very a novel concept coming from a manufacturing organization, and especially IT companies, research companies. And your solution is quite interesting. And we will be talking about some time back how in next 5 years the uni-channel experience for each patient is going to be through the mobile.
Correct.
So it's just about whether it is a radiologist or it's a vet or it's an ECG, any of the services, telemedicine, and the continuum of care, portability across multiple healthcare delivery institutions. So I think the way you have come out with a kind of a health in your own hands
Platform. Correct.
through your platform. Excellent. Thank you very much for being with us.